keynote address. For delivering the keynote address, I invite Dr. L. Swasticharan, Additional Deputy Director General of Health Services, Ministry of Health and Family Welfare, Government of India. Dr. Swasticharan is currently leading 3 national programs at national level: Tobacco Control Program, Oral Health Program, and NCD Control Program. His main interest is in operational research and prioritizes public health issues based on evidence and best practices from across the world and tries to adapt and implement them in our national settings. I welcome you, sir, to please deliver the keynote address.
Thank you, Garima. Respected Sri Banagupta-ji, who had to leave because of some urgent work, the Honorable Health Minister, Government of Jharkhand, and colleagues present here with me in this inaugural session virtual dais, and my other dear participants from across the country who are with us here for this National Summit on World No Tobacco Day 2020. It is indeed my pleasure to be here with all of you in this first of its kind virtual summit, which is now going to be the new normal for at least few months or maybe a year. Like every year, we observe World No Tobacco Day. I would like to use the word observe because there is no such joy associated with tobacco as such on any day. It causes diseases, it causes deaths. So we are observing the World No Tobacco Day on 31st of May, and around this day, we once again churn the various aspects related to tobacco control, the causes, the issues, the challenges and then we try to do a common attempt to face them and try to solve them. This year's theme, as we have been shared by many of us in their previous speeches, is protecting youth from the industry manipulation and preventing them from tobacco or nicotine use. We know that WHO has added the word nicotine particularly here. I think this is very, very important. The tobacco industry manipulation dates back many, many years when the addictive nature of nicotine was known to the scientific world, which is available with the Public Health Society as well as in the tobacco industry realms. But they kept on denying that tobacco or the nicotine does not cause any addiction until the scientific evidences, overwhelm this concept of nicotine not causing addiction and started saying that nicotine is the main cause of addiction in tobacco among all the chemicals. And then the industry started projecting that nicotine is a very harmless drug. It does not cause cancer by itself. It is not carcinogenic. It does not cause any major diseases and so on. But friends, if you see, if nicotine is the most addictive substance, this is the substance which are going to keep you addicted to that particular product. So maybe it is in pan masala, which is spuriously added to it or purposely added to it, or maybe in the SLT products that you have across the world, or maybe in any of the smoking product, it is the nicotine that is going to trap you. One more thing which is important about nicotine is when it is introduced to the body, it starts acting in the neurotransmitter level, and then if you introduce nicotine to very young children, as young as possible, and if you let them have the nicotine in any form, whether in the form of vape or smoke or emission from the smokeless tobacco, chewing, the nicotine which passes through the blood-brain barrier fast enough and a very high dose determines how addictive you would stay throughout your life. So this is why the theme is very important. Catch them young. This is the theme which is hidden in this particular theme of the year. The tobacco industry, in their attempt to replace the death or the dying customers every year, for example, in India, 13 lakh people die every year. That's the loss of the customer base in India every year. So in order to replace these dying customers, the industry tries to trap the youngsters early in life so that they remain tobacco or nicotine addicts throughout their lives. So we in the tobacco control community roll out many youth-related programs to enable them to deter initiating or starting tobacco or pan masala use, which may contain nicotine, so that they do not start initiating the use of tobacco as well as nicotine products. So this is a race against time. If we succeed, we succeed. But if we fail, we will have citizens in future who use tobacco and who later on will suffer from many diseases and finally have premature deaths. So in today's sessions, we'll have many ideas, threats, and discuss along with many best practices across the country, which work. And then Ministry of Health, in all the working program, we are also trying to have an all program approach for tobacco control. We are trying to integrate National Oral Health Program, the National Program for the NCTs, the National Program for the tuberculosis control, and many other related activities where tobacco could be a factor. And so when we try to roll out all the programs together in an all government approach to tobacco control, that is how we can see measure results. The COVID situation has given us a time to reflect about the best practices that we have been doing. And it has also given an insight that if the tobacco products are not available, it was not that difficult to quit. The industry had projected earlier that once you are addicted, it's very difficult to quit. We are trying to help you to quit through the nicotine gums, which some of them even produce themselves. But during the COVID situation, we found that when the tobacco products were not available, people were not that were not that suffering as was projected by many of the people in the industry. So first of all, I would like to thank the organizers, the RCTC in PGI Chandigarh, the Cypher, and the union for organizing such an e-summit. And for the first time, it is a very successful event, and I know the number of participants who have registered for this summit, and it is a very overwhelming response. I think this is the new normal, which will continue for many months now, and we should also adapt ourselves to the new kind of summits that we have in future. And I wish to encourage all the participants to have very engaging, fruitful discussions. This is an opportunity where we can learn many things from many of the states. I know many of the states in India have got very distinct best practices which they have done it, and it is during this kind of discussion that we learn from each other and we try to adapt it in the situation that we have with us. So without much ado, I would like to wish the summit to continue, and would like to join during the discussions and learn as much as I can, so that we can also march towards a tobacco-free India in future very soon.